Hello everyone, and today my presentation is on Karl Gustav August Bier and his use of cocaine for intraspinal anesthesia. So August Karl Gustav Bier was born on November 24th in 1861, Germany. He was a surgeon and the first to perform spinal anesthesia and use intravenous regional anesthesia. Bier was a professor at the University of Kiel, where he began researching hyperemia, or the accumulation of excess blood in the blood vessels supplying an organ or area of the body. Through his research, Bier proposed that hyperemia could be an effective therapy for tuberculosis, an infectious bacterial disease which commonly affects the lungs but can also affect other parts of the body. And while at the University of Kiel, Bier worked with Heinrich Kinke, a surgeon who developed a procedure to remove cerebral spinal fluid from the spinal canal using a needle. This is also called a lumbar puncture. And he used this method as a method to diagnose numerous diseases. And at the time, Kinke was studying the physiology of cerebral spinal fluid. And while working with Kinke, Bier first considered the effects of using the lumbar puncture technique to administer anesthesia. Bier hypothesized that a small injection of anesthetic into the spinal cord could suppress pain sensations enough to perform major surgeries. And here we have the diagram of lumbar puncture technique into the spinal cord with the spinal needle, where we would collect the cerebral spinal fluid. So cocaine usage in medicine. The first scientific use of cocaine was recorded in 1855 when Frederick Gaddick became the first to chemically isolate cocaine, the most potent alkaloid of the coca plant. Gaddick named the compound ethoxylene. The next usage of cocaine in the medical field was a bit eccentric in that an Australian ophthalmologist named Karl Kohler instilled a 2% solution of cocaine into his own eye and tested its effectiveness as a local anesthetic. He did this by pricking his own eye with needles after injecting the cocaine. Now, there's an extreme experiment that took advantage of the numbing effects of cocaine and also made cocaine a local anesthetic for eye surgery for some time. Then approximately 13 years later, Bier performed the first operation using spinal anesthesia in the form of cocaine at the Royal Surgical Hospital at the University of Kiel. So intraspinal anesthesia. So let's talk about Bier's surgery. His patient was a 34-year-old man with tuberculosis. Bier's patient had contracted the disease in his lower leg and now required partial amputation of that leg. So what Bier did was he injected a cocaine solution into the man's spinal canal and waited 20 minutes before beginning the amputation. According to Bier, the man reported having no feeling in the lower half of his body, remained conscious throughout the operation, and also informed Bier that he had not felt any pain. Bier also noted that the patient could not move his limbs throughout the procedure. Following the successful surgery and use of spinal anesthetic, Bier repeated the anesthetic technique on 5 other patients prior to surgery. All of these patients reported vomiting and severe headaches that lasted for a week following the spinal anesthetic. Bier hypothesized that these side effects resulted from the circulatory trauma to the central nervous system, or excess loss of cerebral spinal fluid. And today, surgeons have advanced on the use of intraspinal anesthesia and made the use and procedure much safer than Bier did, as in much safer than putting cocaine in your spinal canal. So today, doctors use a combination of anesthetics, opioids, and non-opioids to reduce feeling and swelling in surgery to successfully conduct procedures. Thank you, and I'll be all.